Hello and welcome to today's Lunch and Learn. My name is John Gardner and I'm the Director of Title IX and Training here at ATSU. Really excited to have you here today as we talk about benefits within our Human Resources Department. You could be joining us a couple of different ways today. One way is through Facebook. If you join us through Facebook, please be sure to ask questions, type those into the comments box, and we'll ask those questions of our guests today. Additionally, you could be joining us on live stream. You can also ask questions that way, so we hope you'll engage so we can make sure that we're answering the specific questions you might have about benefits today. Additionally, if you would like to watch the show again later or tell a friend about it that couldn't make it today, we'll have a recording put up later on our YouTube channel, so please be sure to check that out or share that with your friends. So as we get started today, our guest today is Kelcey Williams. Kelcey is our benefits coordinator here at ATSU. Welcome, Kelcey. It's great to have you.
Thanks for having me.
Well, we're going to talk a little bit about benefits today, but when I initially think about benefits, I often think about like, what health insurance plan am I going to choose, or how does retirement look? But you're going to talk to us about something a little different around benefits and some of the things we offer today.
Yeah, we're going to take a different perspective on benefits today, not just talk about health insurance and life insurance, but really our health and wellness programs that we offer here at ATSU. You may have seen a million emails come from me about some focus groups that we did a couple months ago. And so today I really just kind of want to focus on what we learned from those focus groups and what our goals are coming up.
Cool.
Within the next year.
Awesome. So I understand you have a little presentation for us. All right. Well, do you want to just jump right into that?
Yeah, absolutely.
All right.
Okay, so these focus groups, our goal, most of the time when you see us or we're speaking to you about our benefits, our insurance, or we have seminars where we have guest speakers who are talking to you, but we don't really ever get to talk to employees about the benefits that we offer. What could we be doing to make your lives healthier? And so that was the goal of these focus groups. It was to engage employees, figure out how we can better help them live healthier lives. We held 14 focus groups overall.
That seems like a whole lot.
It was a lot, yeah. It took about 2-3 weeks total, I think. We held 6 here in Kirksville, 1 in St. Louis, 6 in Mesa, and then 1 online.
So you wanted to make sure you got all different employee types had an opportunity to attend.
Right. Here at ATSU, we're all over the nation, so we wanted to make sure that every employee had an opportunity to speak.
Awesome.
So
awesome.
over 100 employees attended those focus groups, so I was pretty proud of that number. If you weren't able to attend those focus groups, I'm going to kind of give you an overview of what we talked about. We really centered the focus groups around 5 basic questions. We didn't always stick to those questions, but they were consistent through each focus group. So I'm going to go over each questions and then kind of just talk about what we heard.
Yeah, absolutely.
So our first question was, how can we improve your health? How can we improve each employee's health at ATSU? Right now we have our Still Healthy program, which is our wellness program. We have a fitness program. But we want to know, is there anything that we could do more of? Is what we're doing now enough, or can we improve on it? So what we heard from employees was a healthier culture at ATSU is wanted and needed. And what we mean by that is healthier food options at events, more supervisor support, and living healthier lives. And when I say living healthier lives, I don't just mean physically. I mean mentally, emotionally, financially. We want you to live a whole, the whole person healthcare motto that we have here at ATSU. We want you living that life. So supervisor support and encouragement was huge during the focus groups. We heard that a lot. And then also convenience. A lot of times, part of our wellness program is to go get a wellness exam. That may not be the easiest thing to do. Of course, you have to make an appointment. You may have to drive quite a distance to get to that appointment, and it takes time away from work. So convenience was huge. Bringing exams to employee, or just maybe not even exams, but the flu shot clinic and other ways that we can make these types of programs easier for employees.
So when you're talking about culture, and I think that's such a hard word to nail down sometimes, but it sounds like what you heard from some of the employees were, how do we put things in the work environment that are easily accessible and meaningful for them
Yeah.
around ways that they can choose to be healthier.
Right. And we don't want you just living a healthier life here at ATSU. We want you to pass that along to your family, your friends, and live it outside of ATSU. Because, you know, the research shows that the healthier you are, the more productive you are at work, the better retention rates you're going to have, the less work you miss. So it's kind of just like a full circle ordeal. We want everyone to be their best selves.
Awesome.
So another thing we heard from the focus groups were there was a lot of talk about interest groups. Is there a way that we can set up some type of interest groups for employees who may be interested in running marathons, or maybe they're trying to lose weight and they want to share recipe ideas? I don't know logistically how we can do that, but it is something that we're looking into to see if it's feasible.
So that sounds like maybe learning some information or maybe some skills around how to be healthy, but also those connections are probably valuable too.
Absolutely. People, you know, employees want to hear those success stories. You know, what worked for this person in losing weight, or how did this person get started running marathons? And so just sharing those tips and interacting with each other, I think, is a huge way to, you know, uplift the culture here.
I hear running marathons, and I think more like, can I just run around the block?
Yeah,
maybe that'd be a starting point.
I wouldn't be in that group, but I'm just saying, you know, whoever, yeah. So our second question we asked was, would you participate in an incentive program rewarding timely health screenings? So as I mentioned before, part of our Still Healthy program is to get that wellness exam. We have seen a lot of organizations out in the industry go towards an outcomes-based program. Ours right now is solely participation-based, which means if you complete all 4 requirements, you're going to get the Still Healthy discounted rates.
Right.
And so we were wondering, would employees be open to the idea of an outcomes-based program? Would they be willing to go and do more screenings if there was an incentive for doing so?
Okay.
We kind of got, I think, mixed feelings about it. One of the biggest things we heard were privacy concerns.
Oh, yeah.
What are you going to be doing with that information? Which is a huge and valid concern. Privacy is a big issue, and just, you know, so we do not want to know your personal health information. So we would not want to know that. We just want to know that you're taking the recommended steps to ensure that your health is good.
Right.
So if I went for a screening and they said, you have high blood pressure, you'll need to have a checkup in 6 months, I would be required to go to that checkup in order to receive the incentive. I think there was a little bit of I think people would go either way. If it was convenient, that's what we heard. If the exams were convenient here on campus, they wouldn't mind that. If the incentive was big enough,
but there's concern about what happens with that information.
Yeah, and we wouldn't know that information. We would just know if you took the required steps.
Right. Okay.
Yeah.
So.
And so I'm not saying that this is something that we will do. I don't know that. We just kind of wanted to see if employees were open to the idea of that.
Because right now our process is not about necessarily the outcomes of where your health is going, but it's just about, did you do these things?
Did you do it? Yeah.
And so this would be a different way to look at that, and it sounds like you got maybe some mixed reviews on
Yeah,
that.
and also the program that we have now, we don't know if it's really helping employees live a healthier life just because it is participation based. We don't know that you're getting better or avoiding diseases by going and getting that wellness exam. We hope you are, and we've heard stories about how employees have maybe caught something during their annual wellness exam that they wouldn't otherwise had caught.
Right.
So it's great to hear those stories. We hope you're living healthier lives, but we also don't want employees to just feel like they're jumping through the hoops in order to get that discounted premium.
Right.
So.
Well, I think this might be a good time to point out that this Lunch and Learn right now counts as one of our Still Healthy credits.
It sure does. Yeah. Today is a Still Healthy seminar credit. Make sure you go online to mysigna.com and give yourself credit. All you have to do is put in today's date, and then there's a little checkbox that you verify. You don't have to put in what Still Healthy you watched or anything. Also, this is going to be recorded, And if you would like to come back and watch it later, or maybe you weren't able to attend today, you can do so and give yourself credit later on.
Or if you found it valuable, tell a friend about it.
Yeah, absolutely.
Awesome. Very cool.
So our third question that we talked about was what monetary or other incentive would encourage ATSU employees to meet their healthy outcome goals? Right now, the current way our program is structured is if you complete all 4 requirements, you're going to get a discounted insurance premium rate for the following year. And then also in January, I don't know that a lot of employees know this, but if you complete the Still Healthy requirement in January, you get a Still Healthy bonus.
I didn't realize this until this day.
Yeah.
I thought, wow, I just got a huge raise, and I realized it was just for that month, but it
Yeah.
was still great. I mean, it was such a nice, nice thing.
I don't think a lot of employees look at their pay stubs, unfortunately, so they're not really sure that it's there. But in January, if you're on an individual plan, you get $100, and if you're on a family plan, you get $200.
Yeah.
So that's a nice bonus in addition to the Still Healthy premium discounts. So, I mean, I think we're giving quite a bit right now, but we
Right.
want to know, is it enough? Could we be doing more to encourage you?
Does it motivate people? to
Yeah,
make
does
changes?
is it enough to motivate people to participate in the program and
Right.
make healthy changes? Some other ideas in addition to the monetary incentives were fitness gear. Really like physical gifts basically were huge. So fitness gear, maybe fitness trackers, even of course time off work is always great. Services like personal training, massages, and then but what the main thing that we heard is do not take our Still Healthy premium discount rate away from us.
Yeah.
We like knowing what we're going to pay each month for a full year for health insurance premiums, and so I think that's the biggest takeaway we got from that. A lot of organizations, what we talked about, what if we, redid the structure of this and you got a bonus for each requirement that you
So
that
for
you
each Still
satisfied.
Healthy you did, or for completing
Right.
the fitness assessment.
So
the wellness
instead of
assessment.
right, I think a lot of organizations are going to like quarterly bonuses. So instead of doing that premium discount, we could do these types of quarterly incentives where you may not complete all 4 requirements, but you would still get something if you only completed 1 or 2 of them.
Okay.
But what we heard is, we like that steady premium discount. Don't take it away from us. So.
Well, my wife works at a different institution of higher ed, and they get credits for they'll talk to a fitness coach for an hour,
Yeah.
and they'll get $75 or
Yeah.
whatever. And it's a fine program, but I think both she and I agree that this program that we have here at ATSU really serves us better.
Yeah, it's nice for budgeting purposes. Just kind of, again, knowing what you're going to pay each month for the year for those health insurance premiums is huge. The reason I think we were kind of going towards that or asking that question is one of the reasons we heard that people don't participate in the Still Healthy program is because they don't want to take the online health assessment.
Okay.
For privacy concerns, they're not sure where that information goes.
Sure.
But once again, we don't get that information, nor do we want it. Another reason is part of the Still Healthy program is that you have to be tobacco-free or enrolled in a tobacco cessation program. And some people just may not want to give up tobacco for whatever reasons.
Sure.
And so the way we have the program is designed now is it's an all or nothing. Either you complete all 4 requirements and you qualify for the Still Healthy discount, or you even if you only completed 3, then you don't get the Still Healthy
Right.
premium discount.
Right.
So this was a way for us to maybe get involved some of those people that still wanted to partake in some of these requirements, but not give up everything. But I think what we heard is just, we want that premium discount steady and don't change it. So.
Right. So on the fitness gear, is that Fitbits? Is that what people are talking
Yeah,
about?
I think or even just like athletic gear, like workout clothes.
Oh, okay.
Maybe Fitbits. That was a huge one. Fitbits, activity trackers, even like dumbbells and
okay, so just workout
yeah,
equipment, stuff you get out
workout
of your house.
equipment.
Yeah.
Yeah, just anything related to fitness. So.
And the personal training massages, my thought on that is I go back to the convenience part. So I'm thinking like there's like 40 tables laid out in the commons, you know, or you know, over in the Y in Mesa, and then everybody's getting massages.
Which I think we've done that before. We've had chair massages down in the commons before. We haven't done that in a while, but it was well received, and so
I'm sure
that may be something that we bring back.
Okay.
So.
All right. Very cool.
So the fourth question we asked is, would you use an on-site or virtual health coach? Currently, we do have access to our virtual health coach via the Cigna network. You do have to log on and or call them, and they're available 24/7 to speak with you, whether it's about weight loss or maybe you're trying to quit smoking. They are available. They are a resource to you to use for those types of issues. So we wanted to know, what if we had one on site? Would you be willing to use them? Again, I think we heard that privacy was a big issue. And of course, it's a valid issue or a valid concern. Again, we wouldn't know that information. We wouldn't know what you went to that health coach for, but employees were open to the idea mostly, especially if somebody was there to help them, you know, design a workout regimen or maybe help them figure out what diet is best for their body, and help them set goals so that they can, you know, reach those healthy living habits. And then also just for somebody, just to know that someone's there and that you have access to someone at any time was a huge, I think, well-received topic.
Well, I would think if you're trying to get started working out, and for me, I just don't have a lot of information about this stuff, and so, you know, what are goals that are reasonable, you know, because sometimes people set goals that aren't reasonable and then they get discouraged, or they go too hard at first and then they end up injuring themselves. And so I would think this would be a really nice feature to have in terms of trying to get yourself going in the right way.
Absolutely, and I would always encourage anyone, if they are thinking about starting a new fitness regimen, of course, talk to your doctor, make sure it's right for you, but also Dan Martin is a huge resource for us here at ATSU, whether you're on the Missouri or Arizona campus or maybe you're remote. Dan, I know, would be willing to answer any questions that anyone has and help you develop a workout regimen that's right for you. So.
And the virtual trainer, just to be clear, is available now.
Yes.
We can use that through, we can go to the Cigna site and there's a phone number you call or something like that.
Absolutely, yep.
All right, very cool, all right.
The last question we asked was, have you used GoodRx or some other cost savings program? So many of you may have not heard of GoodRx. A lot of employees didn't know what it was. GoodRx is a cost savings medication program where they have an app and it's online. You can go online, put in the medication that you're needing filled and your location, and it's going to show you the cost of that medication at pharmacies near you.
Oh, okay.
Also, they have coupons, so you may be able to save some money for that medication.
So just like when you go to the grocery store, there's coupons and it says, you know, you can save this much over a year or whatever.
Yep. So just to make this clear though, the GoodRx, if you use that coupon, it's not going towards your insurance deductible. It's separate.
Okay.
But I think one of the things that we fear is that employees are just paying whatever the pharmacy says that they have to pay and running it through insurance, when that may not always be the best option.
Oh.
A lot of times there's other ways to, you know, not running it through insurance, and getting these coupons are going to save you money versus running it through insurance. We also heard that there was an employee whose son had an EpiPen prescription, and it was going to be like a ridiculous amount of money for this medication. And she went out to the pharmaceutical website and found a coupon for a year for this EpiPen, and now she's paying $0 for this medication.
Wow.
And then I heard, you know, we talked about this, I heard after the focus group, someone went out to they were on a routine medication, they went out to the website and found a 6-month prescription and like cut their costs in half. So I think we just want to make employees aware to be a good consumer of their own health dollars.
Right.
And it might take a little bit of effort on your part, but it's worth it. it's worth it to go out and see if there's any coupons available, and is insurance the best option for medications.
And this is not about saving 50 cents on a can of soup.
No.
This could be hundreds of
These-
dollars,
yeah,
or
it can
thousands
be,
even.
It can be a huge savings, and I'm not saying it's always going to work.
Right.
You know, insurance may be the best option, but it's worth taking a look into and doing some due diligence and, you know, figuring out what the cheapest option is.
Very cool.
In addition to this, we did hear of another program called MD Save. It's similar to GoodRx, however, it's more geared towards procedures versus medications. It's just mdsave.com, and you can go online, put in your location and the procedure that you're needing, and then it'll show you the costs at various participating locations. Again, this wouldn't be ran through insurance, but it may be more cost effective for you.
Right, so if you might have a high deductible or something like that, this might be something to think about for some of those lower cost procedures.
Right. And also, just to point out, we have both of those options right now through mycigna.com.
Okay.
If you log on, you can price medications and procedures.
Okay.
Just so you know what to expect. So.
Cool. All right. Well, let's take a short break here, Kelcey. This has been fantastic information. I think we've got a lot more good information to come. Remember, if you are watching at home and you have a specific question, don't forget to send that in, whether you're watching on live stream or Facebook, and we'll answer that during the show. But we'll be back in a few minutes. We've got a short commercial break here that's going to be Dr. Erla White, and going to be talking about the dual degree DO MPH program down in Soma. So enjoy that video, and we'll see you in a few minutes.
Hello, I am Dr. Erla White with A.T. Still University School of Osteopathic Medicine in Arizona. It has been a tremendous pleasure and honor to work with our dual degree students who are earning simultaneously a Doctor of Osteopathic Medicine and Master of Public Health degree. These students are on their way to becoming physician champions of the future.
Really what we were looking at was how can we improve this population's health with regards to a particular problem, and dealing with the issues of getting providers and medical staff to be on the same page when it came to coordinating care among multiple patients who they may not see every day.
And basically what we did was we developed a grant. We're looking into using a genetically modified lactobacillus strain to decrease the rates of bacterial vaginosis among women in Durban, Africa, who are at high risk of acquiring HIV.
And we basically went to different places in different villages and spoke with patients. We screened them for high blood pressure and high blood glucose, and talked to them about what could happen if they don't see a doctor and the long-term complications. Practicing medicine and public health in a global perspective is just very different. We saw 1,600 patients in just 9 days, which is an immense number.
We start second year seeing patients in the clinics, and that's actually how I got connected with this Marshallese community, seeing the patients in the clinic, and then I would go home and do my assignments, reading about the unique public health needs of this community that I was seeing in the clinic. So that very naturally led me into this project where I've now gotten to meet members of the community. I've had meetings with community leaders, talked with some of the individuals of the community, got to hear their needs and their vision for how they want to see the health of their community change in the future.
I've had students at Circle the City, the Healthcare for the Homeless Medical Respite Center, do specific needs-based projects for our program there. And what it is, it seems to me a win-win for everybody. The students get the education of working with that population and identifying needs, and being able to create a positive impact based off of those needs. And then of course it's a win for our community. The other place that I've seen the dual degree students shine is internationally. Every year we support a clinic and various clinics throughout rural Guatemala, and our students have been able to do needs assessments in those areas and provide education to the communities and community empowerment through that. When we do research, we need to make sure that we are passionate about it and that we have a goal of community empowerment and fulfilling a need. And so if you have those, I think you can really take off, and we've seen students take off in so many impressive ways. I mean, they've really shown me by coming here how much of an impact you can have as a student.
I had a lot of hands-on experience, and I met a lot of people in public health and learned about what they did. I learned a lot about making deliverables for the public.
I think one of the biggest takeaways was just learning how to start this like big project from the very beginning, as far as like the IRB and the grant proposal, because I've always been involved in the later stages, like reaching out, asking a professor or a mentor if I can help out, and all of this has usually been done. Later in my career, when I actually want to start something from the very beginning, I'll have some sort of an idea of how to get it started and what it all entails.
The thing is, I think public health professionals look at the big picture, and then the healthcare providers look at the small picture, the individual. So sometimes I think between the two, there gets to be a disconnect. And that's where I think the dual degree program and projects like this can help bridge the gap between the two professions.
Yeah, I think it was important to understand how well people need to function together to start creating meaningful change for different populations.
I learned about the need outside of the United States. I mean, there's a lot of need here too in the rural parts of the United States, but it's much greater in countries like Bangladesh and there are other developing countries. I'm lucky to be training in a place like New York and ATS still. So I hope to basically continue my training here and hope that I can take my education to countries that also need a lot of help.
And really ultimately it kind of came down to what's called the quadruple aim for population health. So not only that patients should have a good experience, that they should have low cost, but also that the people taking care of them can do their job efficiently and effectively.
Reach out to mentors and preceptors that their career paths kind of align with your interests. That way, you're not only finding a mentor in the field of public health, but just a mentor in general that can help you both grow professionally and personally as well.
If we look at the future of healthcare, and if we look at especially primary care, having the extra education and leadership and community health in electronic health records, all of that can only make you a more well-rounded physician and leader for your communities.
Don't be shy about what you want to do, just voice your ideas and figure out a way to do it.
You won't just be treating high blood pressure, you'll be looking at all of the interactions in the community that you're working with and how their diet and their lifestyle and all of these different cultural factors play into their wellness and how we get to try to make them or help them get well.
Yeah, but it's been really rewarding. Definitely feel very well prepared to kind of step into residency and start looking at those problems with their populations and how we can keep moving forward to get them to better health.
These exemplary dual degree students have modeled the way with these projects and demonstrated through these projects how interprofessional healthcare members and teams might work together across geographic boundaries to serve diverse communities in an effort to address underrepresented topics and to aid people who are underserved. Please join me in applauding ATSU Soma and our partners for going above and beyond to provide these rich opportunities.
Hello and welcome back. I hope you found that commercial on the DO MPH program informative and helpful. Again, I'm here with Kelcey Williams, and we're talking about some of the benefits that we have here at ATSU. So we've talked a little bit about some focus groups that you did in terms of ways that we can improve the benefits, particularly like the fitness and wellness programs that we have here at ATSU. But there's some other resources that are available to us.
Yeah, we also talked about the current Still Healthy program and Still Healthy seminars, and just how can we communicate better with our employees. Some of the things that we heard were we need more Still Healthy resources. So things have been developed since those focus groups to kind of help employees.
And that's only been, what,
a couple months ago.
Yeah.
Yeah. So if you log on to the portal and go to our HR site, you're going to see these tiles. The ones in red are new tiles that IT has helped create as a resource for employees. So one of them is a Still Healthy calendar. If you click on that, I'll show you here. It's going to take you to a calendar that looks like this. This has all of our upcoming Still Healthy seminars for the year.
Okay.
And you can add this to your Google Calendar so that you have it as a calendar on your list.
So just like on the left-hand side,
Yep.
where all of our calendars are,
Yep.
you just click on this one, you'll see anything that's coming up.
Yep, absolutely. So as you can see, May's almost over with, but I know we have a lot coming up in June, and I'm going to kind of highlight the ones that we do have coming up. But going back to this, I'm actually going to switch over to the portal here. This is the page that you'll see once you go to the HR department page.
And so you can do that by searching
Yeah.
or by going over to the departments?
Let's just go back home here. So this is the home page. If you go to departments and then click, I guess it just went to HR. This is the HR department page. So we have the Still Healthy calendar, which is new, which I just covered. And then we also have, a lot of people don't know this, but clinic employees have a different website that they have to view Still Healthy seminars on. Compared to regular employees.
That's to protect access.
Yeah,
or something
security,
like that?
for security reasons. Normally, you and I would go to a YouTube site and watch all our Still Healthy seminars, but clinic employees don't have that access.
Okay.
So we've set up a Google site specifically for clinic employees so that they can watch all the Still Healthy seminars. So that's now a tile, and if we click on that, it'll take us to it. So it's just a Google site that IT's put together. And we're grateful to them for that. And then also, we've heard from employees, normally after the year's up, we kind of wipe out all of the old Still Healthy videos and replace them with any new ones that we have for the coming year. We've heard from employees that, hey, we really kind of want to be able to go back and watch those old videos as a resource, and maybe we want to show it to our friends and family. So we've created an archive site for employees to be able to access those old Still Healthy videos. Just as a disclaimer though, these videos are not eligible for current Still Healthy credit. You'll have to watch a video that from this current year, the 2019 year, but you do have access to old videos for your review if you want to.
Very cool. That's very nice.
Also, I just kind of want to point out here, when we were kind of talking here in the studio, if there is a way to get to MyCigna from the portal, and there is a way to get to MyCigna from here. So if you just click on Still Healthy reporting, it's going to take you to mycigna.com where you can log in and price prescriptions, look at your coverage, report your Still Healthy credits. There's a whole slew of things that you can do on mycigna.com, and you can get to it from the portal.
It requires another login, and that's another one of those sort of barriers we keep
Yeah.
between what Cigna knows about our health information and
Right.
what ATSU knows.
Right, yeah, you're not going to use your, your normal ATSU sign-on to get to mycigna.com.
All right.
So.
Very cool.
Other takeaways from the focus groups were this was kind of a huge eye-opener for us because we do talk a lot about we want our employees to be healthy, living healthier lives. We want their families to live healthy lives. But we only give incentives to those employees that are on the ATSU health plan, which I think we have a pretty good rate. I'd say 80% of employees are on our health plan, but still there's 20% that aren't on the health plan and that may still do all of their same requirements. They may go and get a wellness exam. They may come to Still Healthy seminars. They may be tobacco free. And so is there a way that we can give an incentive to them for living that healthy life. And so that's something that we are discussing. I don't have any more information other than it was an eye-opener for us, and that we will be discussing it for future.
Because that goes back into that culture piece that we talked about in the very beginning, is if we have 20% of the population that really isn't feeling like they're part of that culture, it's probably
it's an issue.
Impacts everybody else, right?
Yeah, it's an issue. We want everyone here at ATSU to live a healthy life, and that includes those who are on our health plan and those who are not.
Okay.
So another issue we talked about was patient advocacy. I think there's a fear from our side that employees are just getting, going to the doctor, getting their bills, and they're just paying it without ever really sitting down, viewing your bill, asking for an itemized bill, and reviewing it against your EOB to make sure that you're being charged correctly for the services that you got.
And when you say EOB, what is that?
EOB is an explanation of benefits.
Okay.
Whenever you have an EOB, Cigna sends you an alert, and you can go to mycigna.com to view that. And it's going to show you, it's not a bill, but it is going to show you roughly what you can expect to pay.
Okay.
And so it's always good to compare that with the bill that you received to make sure that they're accurate.
So your doctor, you go to your doctor and you have whatever procedure or doctor's visit or whatever, and they create a bill, and they send that to the insurance company. And this EOB just kind of explains to you from the insurance company, we got this bill, this is how we're handling it.
Right, and it's also going to show you how it applies to your annual deductible.
Okay.
So it's a good resource to really look at. And I think we just kind of fear that employees aren't looking at it at all, and they're just paying those bills, and they may not always be right. So, what to do if you come across a situation when the EOB says one thing, the bill says another, and you just know that it's not quite matching up. It's not right. Please bring it to me if you have any question at all. Tanya Fitch on the Arizona campus, Annabelle Vergara on the Arizona campus are also great resources. And we understand that you may not feel comfortable doing so. So if there's someone else in HR that you do feel comfortable taking that to, please please feel free to do so. We won't hold that against you.
So, because you all kind of sit with this stuff all the time.
Yeah.
So you know maybe what those EOBs look like. You know what a bill looks like. So if someone is confused about something, you can maybe walk them through and then maybe help them even get it changed.
Yeah. If we're not sure about it, or we think it needs to be reviewed, we'll send it to Cigna, and we'll just say, hey, is this right? It's not quite adding up. And Cigna may send it off for a claim review, which can take 3 weeks or so. But most of the time, from what I've seen, it comes back in the employee's favor.
Okay.
So it's always good just to sit down, review those bills, and make sure that they're accurate.
Okay. All right.
Another thing we talked about was communication. How can we in HR communicate better with employees? I know that I send out so many emails to employees that it drives me nuts. So I can only imagine how employees feel about it.
Right.
But is there some other method of communication that we could be using to really get our point across, to inform you? We talked a lot about, maybe having brochures with the different kind of programs that employees have access to through the Cigna network. We talked about that. We talked about, flyers with all of our ATSU programs and kind of the difference between them and how they're related. And then maybe even if it's text message notifications, maybe that's the easiest way to get points across to employees. I mean, we're always open to ideas of bettering our communication. So if anyone has an idea, we would love for you to, contact us and let us know.
Right. Okay.
So the last thing I kind of want to talk about is the fitness program here at ATSU. I think there's a misconception that it's related to the Still Healthy program. However, they are separate.
They're totally separate.
They're
no
totally
connection?
separate programs. Okay. You don't have to be involved in one in order to be involved in the other, and vice versa. The fitness program is where you use paid work release time 3 times a week, 30 minutes each, to go and do some kind of fitness activity. It used to be we had fitness assessments that you had to partake in order to participate in the fitness program, but that is not a requirement anymore. The only requirement of the fitness program is for you to submit fitness time in UltiPro
Okay.
and to fill out the monthly fitness log that Annabelle and myself send out to each campus. So filling those out and doing the punch in UltiPro. And if you have trouble with those fitness punches in UltiPro, please contact our payroll department. They'll be more than happy to help you out with those. But that program is separate from Still Healthy. It's not related to it in any way.
So whether or not you use the fitness punches, whether or not you take those 30 minutes 3 times a week, has no impact on
your health insurance
premiums,
Yeah.
everything else. It's not a requirement for
Right.
that. Okay.
Right. Just the log and the fitness punch. And the log, we just made some improvements to it recently. It used to be that all 12 fitness fields were required, and now it's not. You don't have to use all 12 in a month. If you're only able to use, 2 or 3, that's fine. At least you're getting out there and you're moving.
Right.
We just want to know about it.
And it can be any kind of exercise.
Yeah.
I mean, walking,
walk.
running,
Yep.
working out.
Activity, a fitness
lifting
class,
weights, yeah.
group class. It can be swimming. We just want you to be moving, basically. So.
All right. There we go.
Also, to point this out, I didn't say this, but it is up to your supervisor. It's always good to have those conversations with your supervisor on what's the best time for me to take that paid work release time. Is it in the morning, over lunch, or before I go home of an evening?
Right.
So. Now I just kind of want to highlight some upcoming Still Healthy seminars. I think we have a lot coming up, and I think they're good topics. And as always, if you're not able to attend them in person, they are recorded and put on our Still Healthy site. So Laura Kraus from Cigna, she's going to be joining us next Tuesday here in the studio. We're going to be doing this live via Zoom, and I'll send out more information on this in an email closer to time. But we're going to be talking about the different programs that employees have access to through the Cigna network. And then she's also going to kind of break down EOBs even further and discuss, each part of them, how to read an EOB, what each section means, and then what to do if, your bill and EOB don't match and something's off.
Yeah.
So I really think this is going to be a good seminar for employees to view and, just kind of revert back to Insurance 101 and just the whole process. I think this could be a really good refresher or beginning course.
Absolutely.
David Overson's going to be in Mesa on Wednesday, June 5th. He's going to be talking about the stock market and retirement plans in volatile times. He's going to be in Squaro B. Again, if you're not able to attend in person, we're going to put this on the Still Healthy YouTube site. I don't believe this is going to be streamed live, so anybody who's on the Missouri campus or remote who is interested in learning more about this will have to view it on the Still Healthy YouTube site.
Well, I think, financial wellness is something that's often overlooked.
Yeah, absolutely. And like I said before, we're all about the whole person healthcare, and it's not just your physical health, it's your mental, it's your financial health. And so we really want to promote those activities that are going to get you there, basically.
Oh, very cool.
We have a cooking demonstration coming up on the Missouri campus. Carrie Schneider from the Northeast Missouri Health Council is going to be here Tuesday, June 18th at 11 a.m. Join us on the south side of the Centennial Commons. We're going to record this and again put it on our Still Healthy YouTube site. I don't know what she's making yet, but she is going to be bringing 3 recipes, and they're usually really good, easy recipes that you could do at home pretty
easy and healthy.
Yep, absolutely.
All right.
And then Thursday, June 27th, Angela Williams with the Most 29 is going to be here at 2 p.m. in Mohegan. She's going to be talking about the college savings program and how it's beneficial, the ins and outs of it. And we're going to record this and put it on the Still Healthy YouTube site. I don't know if Arizona has a MOST program, but I would assume, or a 529 program, but I would assume they do, so it might be beneficial for Arizona employees to even view this.
Well, and for any of our employees, I think 529s as educational savings funds for college is a great way to put that money aside.
And it just gets you thinking about it,
Right.
So. And then lastly, Keith Elmsley, the chair of the pharmacology department for KCOM, is going to be doing an opioid crisis seminar Tuesday, July 23rd in Mohegan at 3 p.m. We will record this and again put it on our Still Healthy site.
Cool. There's one other thing I wondered if you would take a minute to show us is if we could look, because I know on the HR website, because I work in HR, that there is a benefits page with all kinds of resources. Could we take a second and look at that?
You bet. So again, this is our department page on the ATSU portal. If you click this HR home tile, it's going to take you to our specific HR page.
Okay.
A lot of times when employees come to ask me questions, maybe it's how do I change my retirement contribution, or what is eligible and ineligible for my HSA or FSA.
I feel like you're just listing questions I ask.
Yeah, well, they are.
Yeah.
You are the only person who comes to me now. If you just click on this benefit information link right here, 9 times out of 10, this is the place I'm coming to find all of that information. You know, we have it broken up by section. So if you're needing to change your retirement contribution, we have the forms over here on the right side. HSA and FSA links are right here. There's a whole exhaustive list of what is eligible and what's not eligible to use your HSA and FSA funds for.
Yeah.
I would encourage anyone to, you know, view that list just to make themselves aware.
Okay.
Also, we have our life insurance information over here. We have more Still Healthy resources down here at the bottom. And then also, I just would like to point out this preventive health care flyer. A lot of times we get asked what type of exams count towards preventive care.
Okay.
And there's a huge list here, and you can see they've broken it down by men, women, and children. What is covered at preventive care and what's not. A lot of it's kind of age-based, but if you ever have any questions on if a specific exam is covered as preventive, this is a good resource to go to.
All right, very cool.
Again, today's Lunch and Learn is a Still Healthy credit eligible opportunity. Make sure you log on to mycigna.com to give yourself credit for doing so. The deadline is November 30th, 2019, which seems far away, but it will be creeping up on us before we know it.
Right.
So.
Well, Kelcey, thanks so much for coming to talk to us about benefits. It's been very informative. I think I can say that if folks have questions, I can certainly follow up with you or anyone on our HR team.
Absolutely.
Just really appreciate your time. For those of you watching at home, if you want to see some of this again, or if you want to share with a friend, remember we will have a recording of this on our YouTube channel. We really appreciate you taking the time to join us today. Hope you found it informative and helpful. And have a great day at ATSU.